Hey everyone, I'm going to talk to you about muscular dystrophy for my health topic. Muscular dystrophy is a term that's used to indicate a weakness or a wasting of the muscle, which are the main indicators of the disease. There are many forms of muscular dystrophy, but Duchenne muscular dystrophy, or DMD, is the most common, and that affects mostly boys. As for what causes muscular dystrophy, there are certain genes that are involved in creating proteins that protect muscle fibers from damage. And when one of those genes is defective, it causes muscular dystrophy. For the signs and symptoms, the different types of muscular dystrophy affect different sets of muscles and cause different degrees of muscle weakness. But in Duchenne muscular dystrophy, which is the most common form, children begin to have trouble as pelvic muscles begin to weaken around age 5. Muscles start to weaken in the shoulders, back, arms, and legs over time. And most of the children with DMD will need to use a wheelchair by the age of 12. There's other physical effects like trouble swallowing, curved spine, and shortening of the muscles or tendons around the joints. For the impacts on the child's development, muscular dystrophy is a mostly physical disorder, but there's also effects on the mental and emotional health of the child. About a third of boys have at least some degree of a learning disability. It's believed that dystrophin abnormalities in the brain have effects on cognition and behavior, and learning difficulties usually occur in 3 areas: attention and focus, verbal learning and memory, and emotional interactions. There are several different treatment options for muscular dystrophy. The first is physical therapy. The physical therapist will help the child maintain function by managing the disease's progression, and each child will have different needs based on their age and the form of muscular dystrophy that they have. Treatment options can include stretching and exercise for breathing, improvement for developmental areas like fine and gross motor skills, and physical fitness. There could also be a nutritional therapist. The nutritional therapist will coach the family on what kinds of foods should be avoided, as well as foods that would be best for the child. There could also be a respiratory therapist because muscular dystrophy affects breathing, so the child might eventually need to be put on a ventilator. There are different ways that teachers can support children with muscular dystrophy. Teachers should especially be observant of children with muscular dystrophy in order to be aware of any changes in their symptoms or their energy level or of any signs of increasing fatigue. Teachers should also support children with muscular dystrophy by allowing them to participate in activities at their own pace and comfort level. There are a lot of different classroom and environment modifications that you can do. The classroom, the restroom, and the playground should all be handicap accessible. You can offer thicker or larger materials like for crayons and pencils and things like that to make gripping easier for the child. You can provide or allow the child to use their own positioning device to make them as comfortable as possible when they're not in their wheelchair. And some examples of positioning devices are you can use a wedge, a side layer, there's a standing device, you can use a beanbag chair, and you can also use a bolster pillow, which is a pillow that you can mold in different shapes to make the child comfortable in whatever position they need to be in. Some classroom strategies to support a child with muscular dystrophy. You should encourage the child to be as active as is comfortably and physically possible. Adapt physical education activities so the child can participate. Allow extra time to complete tasks. Provide consistent encouragement and support, and place yourself at your eye level when you're speaking to them so the child doesn't feel like you're talking down to them. And some resources that would be good for teachers and parents include the Muscular Dystrophy Association at www.mda.org, the Muscular Dystrophy Family Foundation at mdff.org, the Parent Project Muscular Dystrophy at www.parentprojectmd.org. And then there's the Muscular Dystrophy Association's Hopathon at www.mdahops.org. This is an awareness and education program for muscular dystrophy. This will be a really good resource, especially for teachers, to get curriculum for their classroom for some muscular dystrophy awareness in their classroom.